Welcome to the CTA podcast. Join us as we critically examine the ideological capture of the psychotherapy field. Here we discuss better, common humanity proposals for a fairer society. Our discussions are thought-provoking, and our guests are from diverse backgrounds, bringing unique perspectives to the table. This is the CTA podcast with your hosts, Jaco van Zyl and Christine Siefen.
Welcome everybody to our next episode of the Critical Therapy Antidote podcast. And we're so excited to welcome Stephanie Winn. And Stephanie, you've been such an amazing friend and ally, for lack of a better word, with CTA and what you're doing to really kind of shine the light, sound the alarm on what's happening in the profession. And also, you know, many of us have been on your show too. So this is really such a special treat to have you on today to talk a little bit about, you know, whatever kind of floats our boat. I think we're going to just roll with this in a really organic way. But just to give our listeners just a couple of quick things about you, and this is only just the tip of the iceberg of what you're doing, but you are Stephanie is a licensed marriage and family therapist. She also hosts a very successful podcast called You Must Be Some Kind of Therapist, and is an associate producer on a film that will be coming out to the public soon. It was called Affirmation Generation, and now it has changed as you have found a distributor, which is amazing. So now that is going to be called No Way Back, the Reality of Gender-Affirming Care. And it's good to have you.
So glad to be here. Good to see you again, Christine. Nice to see you, Jaco. So back in February, we released an early access version to our to limited audiences of our supporters, especially parents who are concerned about their kids, therapists, medical professionals, and politicians. We really wanted to get the film out there. And that early access version has been well received by tens of thousands of people. And now we're so excited that we've been picked up by a global distribution firm that will help people be able to stream our film online around the world. We'll also have DVDs and limited showings in theaters on AMC theaters on June 21st. So people who've already been familiar with the film know it under the name Affirmation Generation, but with this bigger shift, we have a new name, so that's No Way Back, the Reality of Gender-Affirming Care. And this film, of course, my opinion is biased, but I do think it is the best film to cover the gender crisis to date. We feature the stories of 5 detransitioners and 1 desister, as well as expert testimonials from therapists, including myself, doctors, pediatricians, endocrinologists, researchers, and journalists to explore the crisis from every angle.
Can I ask you a question? And I don't know if our listeners will know this. I know I don't know it, so I'd love to have you explain just for a minute what the difference is between a detransitioner and a desister.
Oh, yeah, absolutely. So the difference is whether there was any medicalization. Now, not everybody who's been down either of these paths will necessarily use that term to describe themselves. For instance, there's someone who's a desister in my local community here in Portland who's involved in the radical feminist group, and she prefers to call herself a re-identified woman rather than a desister. But a desister in general terms means somebody who had either been given a diagnosis of gender dysphoria or self-diagnosed or called themselves trans, and maybe they were thinking about going down a path of medicalization, but then changed their mind and re-identified with their sex. Whereas a detransitioner is someone who pursued any degree of medicalization, whether that be puberty blockers, cross-sex hormones, radical double mastectomy, for females, or breast implants for males, or all the horrific experiments that fall under the title bottom surgery.
Right. It is interesting that you call it experiments. If we listen to mainstream media, and if we listen to the popular and the current trend around us, it sounds like it is such a smooth journey into transitioning. when people promote transitioning, especially among children, they say, for instance, Jack Turban, for instance, says that transgenderism in children, so he considers children able to be transgender, to start off with, not gender dysphoric, but transgender. He says that transgenderism in children is not a psychiatric question or a psychiatric condition. It is an endocrinological condition.
Oh,
What do you think
wow.
of that?
Wow. Yeah.
That's quite a stretch. And I don't think I mean, I know Jack Turban says a lot of nonsense, but that's a new one to my ears. So
That's
I
new to
always
me
appreciate
too,
when-
actually, Akko. So thank you for bringing that up, because that's also new to me.
And it's one of these sort of classic cases of narcissistic reversal that we see in the culture at large, where people are twisting things around to mean their opposite, right? You take children who, the majority of the time, thank goodness, are born healthy, who have a chance at a healthy life if given the right support. And then you induce a psychiatric illness, which is the idea of gender dysphoria, the idea that they're born in the wrong body. You introduce that through the culture, and then you say that it's an endocrinological condition. So this is classic, what, malingering, Munchausen's. This is creating a condition, telling a child they have a neurological condition, or excuse me, an endocrine condition, and then inducing that condition by pumping their body full of puberty blockers and cross-sex hormones. Then they didn't have a condition, but they have one now. It reminds me of, in my interview with a detransitioner named Brian, he talks about this incredibly toxic person he worked with that called herself a therapist. And she told him that his own body's natural hormones, his own body's testosterone, was poison to him. And that if he didn't take estrogen, he would be allowing himself to be poisoned. And in fact, it's just the opposite. And frankly, when we call these procedures and these drugs experimental, I think that's rather generous, because an experiment, part of an experiment is that you create a hypothesis and then you create a methodology that will actually test that hypothesis that has the potential to be reliable and valid. And then you measure the results. And we're not doing any of these things.
None of those things
these
are
drugs are being
whatsoever.
prescribed off-label.
Yes.
Yeah.
And the film
the
brilliantly shows that, by the way. I just want to say, which is very hard to watch, because you're at every turn, there is a stop. There's a point at which intervention at every single turn would have turned the entire situation around. But rather than that, there's a doubling down almost that happened with these folks. And that is very, very difficult to watch, especially when you have these therapists who aren't doctors that are now coming up with their own, oh, gee, you have an issue, it's an endocrinological issue. Pretty much that therapist was suggesting the poisonous hormones, your sex hormones, are poisonous to your body. They are toxic. I mean, that is completely out of the scope of practice. That's just even one problem with it is that there are many problems with it, but that's even the first most glaring problem is, since when did you become a doctor to make that kind of a statement? And that's, I think, an issue where we're seeing therapists are stepping out of their scope. Their very basic therapist skills are not being used. Exploratory therapy is being frowned upon. I mean, these are things that are foundational of the profession itself.
It's really astonishing that so many people have the gall to step so far outside of their scope of practice. Like, I'm not sure if the two of you had a chance to catch up on the recent article that came out in the Telegraph about Susie Green, and that Susie Green, former, I don't know, CEO or president or whatever of Mermaids in the UK, had initially Mermaids withheld any documents until they were under legal pressure, and then they turned out 300 pages of emails between Susie Green, who's not a medical professional, she's an activist, and someone in a position of power at the NHS Tavistock.
Yes.
Right. So they're showing this undue influence, and And you really see that, but it becomes more complicated because there are people in a variety of professions going into those professions as an activist first and as that particular profession second. And I've seen cases of this where it's trans rights activists going into homeless shelters so that when youth run away from home because their parents are quote unquote transphobic, that they have someone at the homeless shelter who will usher them along what they see as the correct path. We have that in the counseling field. There was a character I recently came across who was a trans rights activist who was both a social worker doing quasi-therapeutic work and a Spanish teacher in a high school. How many people pursue both of those paths? But it's because this person was an activist first and saw it as their duty to both position themselves in a place to provide so-called gender-affirming care and to be present in the high schools and turn Spanish class into an opportunity to monitor what kind of pronouns people were using for themselves so that they could identify the vulnerable children to target.
It's astonishing. The certainty, the firm conviction that what they're doing is absolutely normal, is absolutely correct. They almost boss it over biology. I've heard some refer to puberty as the problem of puberty or going through the wrong kind of puberty. So when they work with gender dysphoric children or with distressed children, one of the things that they ask is, what would be the right kind of puberty for this child?
What a question.
If the puberty is biologically aligned, and there might be some gender dysphoria or there might be sexual orientation issues, then they ask this question, and they want them to steer this child into a direction of puberty with what we know: puberty blockers, cross-sex hormones, social transitioning along with it, and then eventually surgical interventions. And it reminds me of Hannah Barnes's book, Time to Think. It was stunning to see that Hilary Kaz saw the danger for what it was when she said that puberty blocking or puberty blockade is not actually used as a time to think. But what it appears to her to be the case instead is that it is the first step towards full transitioning. And she was courageous enough to take a stand and to include that in her preliminary report on the Tavistock. I'm sure you're also aware of that.
Absolutely. I haven't had a chance to read Time to Think yet, but and our film highlights that upwards of 95% of children who go on puberty blockers go on to cross-sex hormones. It's not a standalone intervention. And it's dangerous to be on puberty blockers for any significant length of time. The risk of brain swelling that can create potential blindness. Girls' spines aren't fusing properly. Kids are ending up with osteoporosis at age 15 because of puberty blockers, disrupting the body-wide, the body-mind process of puberty, which you can't just separate out the sexualized part of puberty. And it's showing an investment, asking for a name change is showing a social investment. It's digging yourself down a certain path. And the moment you take puberty blockers, you're sending yourself a signal that this is indeed a condition that needs medicalization. And you're making this investment because the moment you start puberty blockers, you're messing other things up and you are halting the development of your own secondary sex characteristics.
Yes.
Right. And of course, this creates even more complications down the line because we know, for instance, that boys who go on puberty blockers will have underdeveloped penises, which for men, that could be a huge source of insecurity. So it's kind of this psychological investment in, well, I'm definitely not going to be a man because now I'd be less proud of my manhood. Plus, having less penile tissue then means that if that boy goes on to pursue the construction of a pseudo vagina, that there won't be enough penile tissue for the penile inversion method. They end up using not only colon, but even tilapia skin. I don't know if you've heard of this. Yeah. But Jaco, you had said this idea of puberty as optional. And I think it's so key that you brought that up, because we know that to be false on a number of levels. For one, it's not as if anyone can simply switch sexes at puberty. And if you only intervene at the right timing, at the right point in puberty, then you'll be indistinguishable, right? Then you'll just look like the opposite sex. It's not like you can change your chromosomes. It's not like a so-called neo-vagina will ever have the same functionality as a true vagina. Same thing with a neo-phallus. So one, it's kind of this illusion that you can change sex, which is really not true. All you can do is change your body to try to appear more like the opposite sex at great cost and consequence to your health. And the other being that we know about the paradox of choice, right? It's funny how our field of psychology has so much insight to offer this crisis, and yet so many of us are being silent on the issue. We know that having too much choice can be paralyzing.
Yes.
And that having boundaries, knowing what your limits are, creates containment so that you can play freely within those boundaries. Kids already have a lot of choices, and one of the important tasks of parenting is helping your kids know where that fence is so that they can play freely in the yard without chasing a ball downhill into traffic, to use a metaphor there. So this idea that even nature's hardest limits of your own biology are something that you have any choice about is a total, pardon my language, mind fuck for these young people.
It is. And you have 6-year-old, and I've said this a couple times before. A friend of mine's 6-year-old daughter came home from school one day and said, "Oh, Mom, am I a boy or a girl? They taught me at school, or they tell me at school that I can choose." I mean, I just about crawled out of my skin, and I want to just say something about gender dysphoria. I have such a hard time with the diagnosis of it in kids, in teen adolescents. I almost trip on the words and choke on the words trying to say it, because I feel as though, and what we're talking about most of the time here, the vast majority, there are other things going on that aren't being explored or looked at or addressed or dealt with. The minute that there's this idea that you must be trans, everything else is thrown out the window. And now the movie very clearly showed how that happens. So I have a really hard time with even using that as a diagnosis or attaching that as a diagnosis to anybody who's under the age of 25, essentially. So I kind of just wanted to throw that out there, because I know we may have different viewpoints about this, but I just can't bring myself to attach that particular diagnosis to anybody who's that young.
Yeah, absolutely. And I think it's part of the problem of the medical model as applied to our field. And I'm curious about both of your thoughts on the medical model more broadly, because I feel like it's been a double-edged sword. On the one hand, the medical model has offered opportunities for us to represent our profession as a legitimate science and to get insurance coverage for therapy. And I think that overall, insurance coverage for therapy in broad strokes is a good thing. It makes it affordable for a lot of people. And probably the fact that people have been able to get insurance coverage for therapy has probably prevented suicides, prevented people from going down whatever their dark personal paths of bad habits or addictions might be. It's probably saved marriages. So therapy being affordable in broad strokes is a good thing. Now, there are a lot of problems with how insurances pay out so differently and what it's like as a therapist to work with insurance. There are reasons why many of us pull away from working with insurance. But in the broad strokes, that's something that the medical model and some of the work that Obama did while he was in office has set up. So I see those advantages to the medical model, but also then if you're billing insurance for therapy, and a lot of clients don't know this in my experience, a lot of people who've been to therapies, let's say, I've had people come to me and they've seen previous therapists before and they've used their insurance before. And I ask about their diagnosis and they say they've never been diagnosed with anything. And it's like, I'm sorry to have to be the one to break the news, but if you've been to a therapist and billed your insurance for it, then you have a diagnosis. Now that diagnosis could be adjustment disorder unspecified. It could be, a really minor diagnosis, but you do have to bill a diagnosis. Otherwise, what is it that you're treating if you're operating in the medical model? So gender dysphoria is a way of slapping a label on a situation, but there's so many different reasons that a child or adolescent might say they don't feel like a girl or a boy. Whether that reason is, and we've seen this in cases, for example, a sensitive young boy, maybe a boy who might grow up to be gay,
Yep.
with an abusive macho father and a loving mother and sister, and he's looking at the family and he's going, well, I don't want to be like daddy, I want to be like mommy and sister.
Yep.
It could be that, right? It could be, as we are well aware, girls who have a bleak picture of what it is to be a woman because of the objectification that they've witnessed, whether they've been personally sexually assaulted or they've just seen porn or they've seen the way that boys act who have watched too much porn. Their picture of what it is to be female is pretty bleak. Or maybe they just spend too much time on Instagram, which we know is bad for girls' health. So there's so many different reasons that a kid could express this, and the diagnosis as it is in the DSM doesn't get into any of that.
That's what, see, and what I loved about, one of the many things I loved about the movie is that one of the people, and I cannot remember her name, she said, like, can it just be okay to be a feminine man without needing to transition? Is it okay to just be a masculine woman without transitioning? And that was so powerful for me because I grew up in the 80s, okay, and the gender roles and all of those conversations were happening, and it was perfectly fine to be a girl and play with what would typically be considered boys' interests or toys or whatever it was, and still be a girl, and vice versa for the boys, and still be a boy. Like, you may like to play with Barbies as a boy, it doesn't mean you aren't a boy necessarily. Maybe you're a boy who likes to play with Barbies. Maybe you will grow up to be gay and that will be revealed, and maybe not. And that's the whole entire kind of arching. So I guess what I'm saying here is that, you know, all these things are good ideas in theory, and then what happens to good ideas is they get taken to some kind of extreme. Somebody starts to exploit it, hijack it, weaponize it, and then here we go with a whole nother definition, and the entire concept has then changed in definition and meaning. So that's kind of my thoughts about the medical model, is that, yeah, it provides a lot of access to care, which is incredible, but then in order for it to actually work, you know, it's being taken to some extreme level that isn't taking into account the nuance of each individual patient or client, the nuance of their experience. That's getting whitewashed. And it sort of seems like when we come up with good ideas, they eventually become exploited and weaponized. And that's where I have a huge, huge problem and sort of, I guess, conflict. Yako, you may want to step in about your feelings about that. The medical model.
Yeah, I agree with Stephanie, and I agree very much with what you just said, Christine, that there's got to be some rigor to our field. Otherwise we get, this phenomenon, and we sometimes do get it with some therapists who just thumb suck a diagnosis, or they just have a certain counter-transference towards someone, and then there goes the diagnosis. So it adds rigor, I get that. In terms of patient intrapsychic structure, I think there's got to be something said about diagnosis as well. To some patients or clients, diagnosis is an explanation. It points to something bigger. It is the first step towards exploring a wider map. It creates a rough outline of a map, and that is nice. The person didn't just arrive at a diagnosis and remain static and stuck with that diagnosis. It's not a label. It is not necessarily an identity to that person. But to some clients, it's also an excuse. To some clients, it is also something that does become their identity, and there's no more exploration. There's no more digging and trying to understand the self and how, our background music plays into our internal structure. And that is where this problem could creep in. And I think the current expectations by the dominant narrative and by politicians and activists just facilitate this. Now you have a static identity. The map that is laid out is a medical map. It is medicalization. And there is enormous social privilege that you get
Yes,
through
the
transitioning.
secondary gains, right?
That's a secondary gain that we also want to go into. What do
I
you
really
think?
appreciate you bringing all of that up. I have so many comments, and what I want to start with is I've noticed when you talk about the excuse, of course, there's that secondary gain, and there's the more personality disordered behavior and habits that we see. But also, to be fair, there are a lot of young people who are just not provided with accurate information about what a diagnosis means. So tell me if you've seen this before, because I've seen it too many times to count. And if any current or former patients of mine happen to watch this video and you think this is about you, this is an amalgamation of cases, because this is a composite, because I see this a lot. This is not about any one individual. Young woman in her early to mid 20s who had a little bit of a rough time in adolescence. Could be her dog died, her favorite cousin moved away, her parents divorced, whatever, combined with normal ups and downs of puberty. She went through a time of feeling a little depressed, or she just had painful periods, or even acne, and a doctor put her on birth control at age 13. This will cure your painful periods, or it'll make them more predictable, or it'll help clear your skin up, right? And then from there, she just becomes moodier and more anxious and more depressed and more insecure, gets into some really bad habits. A year or two later, she's put on an SSRI. She's told you have depression and anxiety. 10 years pass. She's given ordinary med management, maybe some therapy. Nobody ever talks to her about a few important key factors. One is the role of hormones on mental health and the impact that having any kind of unmanaged hormone imbalance, or the impact of birth control itself, can have on your mood as a female. Nobody ever talks to her about that. Nobody ever looks at diet and lifestyle factors, how much sleep she's getting, how hydrated she is. Okay, and nobody connects the dots between the hormone issue and the SSRI. And nobody tells her, and this is the most important thing I just want to get to, that depression and anxiety are not lifelong diagnoses. Now, how should she know that? We know that because we have the DSM. And if we look at major depressive disorder, how long do you have to be depressed to qualify? 2 measly weeks.
Right.
That's
2
it.
weeks.
That's it.
That's nothing. Generalized anxiety disorder, okay, 6 months.
Yep.
But there's nothing in either of those that says you have it at 13, you're going to have it for life. Okay, but a girl is told you have depression and anxiety because she's going through normal puberty, because she's having a bad reaction in hormonal birth control and nobody notices, because of whatever. And she just thinks that she has depression and anxiety the same way she might think she had diabetes if she was getting that diagnosis.
Yes.
Like this is some kind of genetic problem. And of course, to make matters more complicated, there is a genetic component. So it's like, oh yeah, well, my mom's been on Lexapro for 20 years too. So that makes sense.
Yes.
Okay, but and so these girls come to me when they're 20, 25, and I'm the first person to ever tell them, did you know that in order to meet criteria for a diagnosis of major depressive disorder, you only had to have been depressed for 2 weeks? Now, of course, there's recurrent and there's persistent, and we know there's, but it's like, this is not this is not a life sentence.
Yes.
So I personally think it's irresponsible of any therapist or psychiatrist, especially if you're in a position to prescribe, to not talk to your patients about the temporal nature of these things and what could be creating them and what could maybe help you get out of them. The idea that I just need to go to therapy every week for the rest of my life and take this pill or take these 3 pills.
Yeah. And I just think, the good old biopsychosocial model, to just see the person as a unique individual, but also an individual not only psychologically or biologically unique, but also someone in relation to themselves, relation to their family, relation to the world around them. Just a simple application of very basic psychological principles. I get that.
Yeah.
And I just think the ultimate result of this is thought termination. There are so many strategies activists politicians, like I said, so many people involved in this field employ to get people to stop thinking. They medicalize, you stop thinking. They catastrophize certain outcomes, such as if you don't transition, you're going to commit suicide. There's the thought termination. I have these terms, I wrote some of them down. When someone disagrees with you, they don't just say, this person disagrees with me. The narrative says, this person hates me. It's a hater. When someone says, caution, take it slow, how about we explore? They call it gatekeeping. When someone criticizes a certain trend, it's not just criticism, it is attack. You're attacking me again.
The definition of
definitions
the
of the
concept change, which then ends up becoming, a bigger issue, and it's an exploitative. So why do those definitions change? Who's in charge of that? Where is that coming from? That would be something that I spend a lot of time thinking about, quite frankly, is how did those definitions change and who is responsible? How much is that, just an outgrowth of, the evolution of a society where we're starting to learn more about X, Y, and Z? Or, are there particularly directed reasons in which somebody or a group of somebodies would actually change the definitions to mean something that they're not? Again, it's the whole idea to me that we start off with good ideas, and somewhere along the way, it was a good idea to be diverse, okay, to understand that not everybody feels the way you do, or sees life the way you do, or experiences how you do. But we have seen how that has been taken, right, and it has, in the definition of diversity and what it means to be inclusive, has changed such that it is actually completely the opposite of everything it was supposed to be about. So again, it's like, where, those things, I don't think we're going to solve this problem or answer this question here today, but that's what I get stuck on a lot, is that how did that happen? How did we get here where now these things have become something that we did not initially start off being, of the field in general, changing into a direction we did not initially anticipate or plan?
Yeah, have we not gate kept our profession enough?
Yes.
Or so many directions to go with this. I have multiple thoughts. If you'll let me go back a little ways, you talked about the sort of just that there are gender, as some people say, gender nonconforming. I prefer gender atypical because it's a more neutral term. I got that from Leonard Sachs. I think his books are excellent on the significance of sex differences in child rearing. And so gender atypical, I think, is more neutral, because when you say nonconformity, that instantly, depending on the personality of the person you're talking to, has either a positive or a negative connotation, right? And so for a lot of us, it's like, we want to be nonconforming because we're rebels, or for other people, it's like, no, I'm a normal person, I don't support nonconformity. But either way, just kids who are gender atypical, I've gotten swept up in this, but I do want to say that as we've seen this exponential increase, that, we show those charts in the film, right? That the 4,000% increase over the last decade or so in girls identifying as trans, as we've seen that exponential increase, this trans category swallows more and more of the young adult population. So I think, although it originally targeted the freaks and the oddballs and the kids with the most trauma and attachment issues, and yes, the kids who were gay and lesbian and autistic, while it originally targeted them, now it's kind of targeting everyone. And so we do actually see, and I see this a lot because one of the main populations that I work with clinically, as well as in my consulting, is parents who are worried about their kids. And so those kids range from the autistic lesbians to actually like really quite normal-ish kids, because it's also not okay to be a cis-het white kid, right? So you see these girls who a year ago were into makeup and who played with dolls when they were 5, and now they're identifying as boys, and it's very much not them, but it's a sense that they're not safe or cool or approved of if they are feminine, and that leaves them vulnerable. So this gets into that topic of secondary gain. And I
Yes.
wanted to open a recent Twitter thread that was brilliant by Laura Becker, who made my shirt. She is on Twitter at Funk God Artist, and she has an Etsy shop where she makes things like this. And she's been on my podcast, and she recently made this thread that puts it so well, and this addresses that issue of secondary gain. So I'm just going to read that to you.
Can you read us what's on your shirt for anybody who's not watching but just listening?
Yeah,
to
it says
show?
D-Trans Awareness Day, and then down at the bottom it says 2023, and it's a funky piece of art of the salamander, which has become a symbol of the D-Trans community because it represents new growth and transformation, that salamanders can lose their tails and regrow them. Right. So on May 25th, 2023, Laura Becker at Funk God Artist tweeted the following thread. I'd love to read it to you.
Yes.
Why wouldn't a young girl want to be trans? Here are 18 reasons why it's only reasonable to adopt a trans identity. 1, you get to be a cool outsider and gain social status. 2, you feel special because you have, quote unquote, secret knowledge about life because you have a, quote, deep understanding of gender. 3, you get to write off your flaws in favor of now being on a path to, quote, becoming a new person. 4, you get to take the hippest current drug, testosterone, which increases confidence, energy, libido, and gives you an edge. 5, you're fulfilling your developmental stage's purpose of rebellion against the patriarchy, parents, tradition, quote, outdated social norms. 6, you have a common enemy against bigots, Nazis, conservatives, and all other manner of the worst people. 7, you have a purpose nestled in the process of transition steps, goal after goal to achieve, which gives you a dopamine as a reward while in pursuit, always striving for more. 8, you get to throw away your old self, the you that has flaws, shame, insecurity, pain, and vulnerability in favor of a fantasy version of yourself. 9, you believe you escape female oppression, sexual assault, unwanted advances, abuse, mistreatment, judgment, or misogyny. 10, you can feed yourself intellectually with queer theory, gender ideology, customizing and personalizing your identity labels as you desire, and can change them at any time, suiting creativity. 11, you feel free to express yourself aesthetically with androgynous fashion. 12, you can hide from adult responsibility or developing deeper, meaningful experiences within abstractions, histrionics over perceived maltreatment, or avoid socialization with the excuse of living in a, quote, transphobic society. Any judgment from others can be excused as bigotry. 13, you find unity amongst like-minded people who also tend to be cerebral, creative, unique, different, and countercultural, so you feel emboldened further in your pursuit of transition goals. 14, you receive frequent positive reinforcement and encouragement for your efforts. 15, you feel a sense of accomplishment, pride, and even superiority over others because of reaching your continuous transition goals, and even for being, quote, enlightened enough to conclude being trans to begin with, a way to feel competence and fight shame or insecurity. 16, you can not only customize your identity, flags, pronouns, and fashion, but also your body through extreme body modification rituals like surgeries, which give a sense of creativity and control over your situation in life, similar to dyeing your hair after a breakup. 17, you feel accepted, seen, heard, and valued because of the vast commercialization of trans inclusion, including in media representation and goods available for purchase. It feels like the world is finally giving you your moment of glory and celebrating your unique self. 18, you can feel like you are maturing, growing, healing, or becoming an adult through transition steps or, quote, understanding deeply, while you may then feel self-allowance to neglect maturing in other ways, or actually growing up, healing, or evolving through life in new ways.
Yeah.
Boom.
Brilliant. Brilliant. Yeah. Every point of that is brilliant. And if we talk about secondary gains, as you mentioned, Stephanie, that exactly lays out what all of those gains look like. That's a lot.
Yeah.
Have you noticed that among some of these communities, the TikTok communities, the Tumblr communities, how they fling around Psychobabble?
Mm-hmm.
See, for us to understand psychology, you first need to understand that there are certain principles of reality, and that you need to measure what you encounter against those principles of reality. And I found that many of some of these kids, they're very creative, but some of them are really hard, have a hard time dealing with the reality principle, dealing with limits and boundaries and the no of life. In psychoanalysis, the no of the father. And then they start going onto imaginary trips, and they have, one psychoanalyst calls it psychic retreats, and they get the sense that I can modify anything in my mind, and whatever I modify in my mind, I can also modify in reality.
Mm-hmm.
And there's the same discourse they employ when they have these discussions around psychobabble. Then there's this, then it's that diagnosis.
What bothers me the most about all of this is that where are the adults in the room, and why are they not stepping forward, and why are they also becoming captured by some of this? Because a lot of this too with the parents, and this came up in the movie, which I was really glad you addressed, is the suicide factor, right? So the parents are also being sort of held, by a noose in a way, no pun intended there, but if you don't do this, your child is going to attempt suicide, your child's going to kill themselves, this whole idea. So then we're bending to the will, right, of this reality that's not reality, as Yakos, you're saying. There's no reality at all about it. It's imaginary. It's not living in the kind of tactical, tangible world we have to live. Right. So now they're getting swept up and the kids are in control. And we know from basic psychology that when you have structures where you don't have kind of the adults that are, the adults in the room that are the ones that are in charge of making bigger decisions, then, you create this dynamic where kids are not, they have no sense of containment, of boundaries, of limits. They feel unsafe. They tend to suffer from depression and anxiety and all of these other issues. So the adults that are watching this and responsible for taking care of these kids, whether it's parents or whether it's the mental health profession, are failing them. I mean, it's just the best way I can say it. They're just failing them. I'm not saying that it is a purposeful, malintended failure on their part, but what I'm saying is this is not a thought through response that people are having to all of this. If we then go and look at, follow the money and look at the secondary gains on that level, that's a whole nother topic, a whole nother podcast. And there are reasons in which, and that was also talked about in the movie, is the business of transitioning, the dollars, right? The political component, right? So those pieces were in there, and that's great, but that's another, whole show. I'm just even talking about the day in and day out adults that are around these kids. They're failing them.
Mm-hmm. Well, and we know as therapists, and this must be part of what frustrates the two of you and many members of the CTA community, right? We know how to actually assess suicide risk. Doesn't mean we get it right 100% of the time.
Yes.
No, there are people who fall through the cracks. There are people whose therapists thought they were safe and they ended up attempting or completing a suicide, and every case is tragic, but we are generally trained in how to assess the level of severity of the threat, the level of care that's warranted. And wouldn't you both agree that if you were working with a family with a teenager that was threatening suicide, you would have very detailed, nuanced, customized conversations with that family, and you would make sure that the parents knew how to keep the kid safe at home until it wasn't time to be at home anymore. You also know what criteria the hospital should keep the kid under and what criteria the hospital should discharge the child under. And I've seen a lot of really alarming situations since the gender stuff came on the scene, where hospitals are keeping kids much longer when they've only had passive suicidal ideation with no plan, means, or intent, and they turn the whole thing into an opportunity to back the parents into a corner, triangulate the kids, give the kids way too much power, do this all in front of the kids, making the whole thing about making sure that when the kid goes home, their parents will be affirming their gender identity without assessing the actual situation that drove the kid. Now, when you talk about the psychobabble trends, that was such a good point, Yako, that you raised earlier about the psychobabble, because I actually want to know how this has landed with the two of you. And Christine, you've been in practice longer than I have. I've been in the field 10 years. So what I noticed is 2016, 2017, I started noticing that adolescence sounded really mature. in their use of words like anxiety and depression. They sounded insightful. And I was like, wow. And I started thinking back to my own adolescence. I was like, was it me? Was it my environment? Was it the culture at the time? I don't feel like I had this kind of language or insight. And so at first I was kind of thinking, wow, kids, they're so mature. I don't know if is it this kid or is it the culture? And then I started to realize they're not that mature. They are in a different culture than I grew up in, where
Yes.
they're hearing these terms a lot and they're applying them with the same level of maturity that, you know, any 14-year-old applies a label that they hear in the culture to themselves. So I noticed that trend, and it caught me off guard at first until I kind of caught up with what was happening with the youth culture on social media. And I'm curious if either of you have had a similar experience.
Yeah, I did. And you know, there was a question. I don't know if you remember, it's still on that show, 13 Reasons, on Netflix. So the show, right, it ends with the entire premise is that it gives over the course of these episodes the reasons in which the one of the main characters decides to end her life, and it almost justifies, right, the reasons through each of these different episodes, where every single person has literally failed her all the way up until the end. And so the big kind of question was, and I was working in grief at the time, and I was also teaching a grief class, and so suicide comes up, of course, because, you know, that's part of, you know, the experience of grief. When you've had somebody die by suicide, how does that, you know, affect the way that you process your grief, etc. So it was around that time, and there was a huge debate that was at my place of employment at the time, which was, okay, is it that we're now, you know, more aware and giving them more of a space to talk about hard feelings and about suicidality, or is there almost a copycat kind of mimicking type of situation going forward, where they don't even understand the depth of the severity of what they're saying and doing? And so I tend to believe it's the latter. And that was the critique of that show, which was, did that, with the encouragement of, look, everybody's failed you and this is your only option, how would these young folks interpret that? And was that something that should have even been shown to them to begin with? So that's a long answer to your question, which is, yes, I do see that. And I did see it around the time. And I don't think they understood their ability. We found a couple of them, their ability to speak clinically almost about depression and anxiety, yet have no real tactical and real reasonable understanding of what that actually meant, was sort of mind blowing for me. And I attributed a lot of it to social media, to things like that show that were coming out at the time that glamorized, in a sense, what it was like, all of the attention and everything that came out of that. You know, suicide was something that some of these kids craved, actually.
Yeah. I'm just thinking in terms of in terms of psychoanalysis, how we sometimes camouflage our pain and camouflage the necessary journey we need to take with very brilliant ways, such as being very clever psychologically, without really having had the blind exploration of your internal psyche. So they have the answers ready, they have the explanation ready, without having had the internal work properly done, the exploration properly done, and with the exploration, the development. Because with the exploration, you also find that you're changing, and you need to have that exploring attitude, the courage to have that exploring attitude, to keep up with your own internal change. Whereas with some of these kids and their psychobabble, they're stuck, they're arrested precisely for that reason.
Yeah. Like they have the idea first, because the idea came from the culture, what they saw on TikTok or whatever. And then the human mind is brilliant at this, right? We have a framework, we have an idea in mind, then we go looking for evidence, and we sort of we interpret everything through that filter. And so they make their inner reality, they make everything conform to the worldview that they've formed prematurely.
Confirmation bias, yes.
Yeah. And we know it's not proper inside. How do we know it? They still suffer severely with these symptoms and with these experiences. Is still thought terminating, still thought stopping. And many, like you also bring out in the video or in the film, are even after transitioning, many of these symptoms just do not disappear, because the gender dysphoria is not necessarily the cause of depression, anxiety, etc., but is the result of so many other of these underlying conditions that find expression in gender dysphoria.
Yes.
So our film addresses that issue of diagnostic overshadowing, right? This
Yes.
dangerous assumption, this myth that somehow adults and professionals are perpetuating, that if a youth has all of these disorders, all these diagnoses or symptoms, and also gender-related distress, that the gender-related distress must be the overarching issue, must be the root cause. And if you so-called treat that by modifying the body to match the identity that's in the brain, so the theory goes, that you will magically alleviate all the other symptoms. But of course, we know that's not how it works, because we understand how the brain develops and how the brain changes. And if you're spending all of your time reinforcing the neural pathways associated with depression and anxiety, rumination, avoidance, external locus of control, if you're constantly reinforcing that, and the idea that you can't be happy, you can't be comfortable in your body, you can't go out and do things, you can't have relationships because you're not transed enough yet, right? Then you're just perpetuating, you're just building those neural pathways of rumination, avoidance, fear, self-loathing, self-obsession, self-consciousness. And then you do the thing that you thought would have an impact, and maybe you get some placebo effect, maybe because you had in mind that you were going to get this benefit, then you have that temporary so-called euphoria. Or if you're taking cross-sex hormones, there is, because they are mind-altering substances, yes, there is a real sort of euphoria that can come from that, especially females who are really insecure. You know, testosterone has an antidepressant effect. But it's such a dangerous assumption to make, right? When someone has a lot going on psychologically and they're not well, the idea that you can jump to the most invasive and permanent and physical of the options available and mess with their endocrine system, which we know has a huge impact on mood, and then that's going to make everything else go away. There's no evidence base for that. And it's the most dangerous assumption you can make. It's infinitely safer. Even if we didn't know half the things we know about this issue, it would still be infinitely safer to start with assuming that the so-called gender dysphoria or the so-called trans identity is a manifestation of the depression, anxiety, OCD, or other issues.
At the conference here in Killarney, the Bigger Picture conference, one of the participants in, it was on a panel, said what they found is currently the most reliable cure for gender dysphoria is puberty and adolescence.
And there it is.
Get it going.
Engage
with it. Confront it. Allow your body to bring about the changes that it needs to bring about. Allow the development to proceed as it's supposed to proceed. Get your support structures in place. Be healthy, eat healthily, have good friends, have good company, and just allow this process to proceed as it should. Eventually your body and your psyche figure it out. That is the best and most reliable cure for gender dysphoria. I think it was a deep transition who said that.
Yeah, of course. And we know that from the evidence, and it aligns with, let's talk about phobias for a moment, right? The treatment for phobias, for agoraphobia, OCD, exposure therapy, right? And it's like that same principle applies. When you make something so big in your mind, you build this mental wall around something, and you make it a lot scarier just through your mental habits than it really is. The solution to that is to demystify it by, as you said, confronting it, living to tell the tale, which I will also say is how I relate to every therapist's worst fear, which is getting in trouble with your licensing board. I live to tell the tale. I think more therapists should take that risk. And I want to talk about risk in general because American culture is so risk averse. Jaco,
Yeah.
I don't know about you, where you are. You said you're in Ireland.
Yes, originally from South Africa.
Oh, okay.
The
Yeah,
situation is a bit different in South Africa. We're forced to
and
take risks.
but I feel like part of how we got here is that young adults don't have a healthy relationship with risk. And when you talk about the solution being to go through puberty, um, part of going through puberty is having a fascination with how far you can push your limits, how far
Yes.
you can push your parents' rules, how much trouble you're going to get in for breaking them, how well you can lie. Okay. Also, the fascination with substances, right? You reach a certain age and you become very curious. Now, some of it's, of course, peer influence, but some of it, I do think there is this natural curiosity because new brain capacities are developing every day that you go through adolescence. You're becoming a different person and you start becoming interested in altered states. Maybe you start having your first sips of coffee or your first sips of alcohol or your first puff of a cigarette. You become very curious about mind-altering substances. And a lot of self-harm is non-suicidal, but when
Yes.
kids do like partial overdoses, when they take
Yes.
non-lethal quantities of things, it's really just kind of like, I want to experience the different things that are possible for my brain, for my states of consciousness. So there's all of that. And then there's interaction with things that spark adrenaline. So I think the kind of risk aversion of American culture creates a lot of trouble for kids because they don't grow up testing those limits. Like, for example, my stepkids are very physically active and they like to climb on things. They like to set up zip lines. They do rock climbing. They do things like that. And I remember we took them to a ropes course and they were literally running circles around other kids their age. And I remember seeing, in comparison to boys their own age, our kids were just confidently navigating all of these physical obstacles. And these other boys look so uncertain in their bodies and so afraid. And I mean, I'm seeing this boy calling out to his mom, "Mom, I'm so afraid." And he's like 4 feet off the ground. He's going to be fine, you know? And I remember thinking, thank goodness my stepkids are so active and that they have a healthy relationship with risk because they're putting themselves safely in situations where they can figure out how to navigate fear of falling and things like that. When I look at that other kid, I think here's somebody who probably spends too much time playing video games. And video games give your brain the illusion that you've learned how to navigate situations like that. But if your body hasn't developed a muscle memory for how to learn these things, then you're behind. And so I think a lot of today's kids are like that kid at the ropes course, where they're spending a lot of time on screens, whether that be video games, social media, TikTok, whatever it might be. And they have the illusion that they understand the world, that they're competent in it, that they know how things work. And they have a lot of these really heady concepts, but their bodies haven't caught up. And so that creates a deep underlying anxiety because they know so much about the world, but they don't know how to solve problems as they come up. They don't trust their bodies to navigate those situations, and they don't have a real grounded in their body's situation, sense of proper risk. When you have encountered proper risk, maybe you've had some injuries and accidents, maybe you've learned some things the hard way, but you've also gained competence and resilience, then you have a more adept fear response where your fear response is better honed to know when is my fear response telling me exactly that I do truly need to avoid here because there's something unsafe, versus when is my fear response telling me that there's an exciting challenge and this is my opportunity to rise to the occasion. So I think because of this relationship with fear, risk, and the real world, because so many kids don't have a well-honed sense of that because of all the time they spend online, then you find that the kids exposed to gender ideology, which tells them permanently modify your body, and they don't have that healthy fear. They feel invincible.
I think there's a portion too of just parenting styles that have changed, because when I was a kid, I remember we'd go outside and we'd ride our bikes in the summertime, leave the house at 10 a.m. and not come back until 9 p.m. There were no cell phones back then. There were no anything. It was just known that we're all neighborhood kids. We're going to be playing and we'd be out, and that was it. There was a lot of that. I remember even growing up. I mean, I had a bad neck injury from diving in a pool incorrectly when I was 5. Now, it seems like today's day and age, there would have been okay, maybe stopping the swim lessons, or maybe like now you need to have the floaties, or maybe now you need to have the, whatever it is, to make sure that all these guardrails are there, right? And my mother, and I asked her this, she died many years ago, but I said, what kept you like from not stopping me, to continue on trying to swim with all of those things? And she said that she was terrified something would happen, but if she expressed her fear to me about it, then I wouldn't do it. And if I didn't do it, I wouldn't have learned to get past that. And I would have never learned to be able to, just get back in the water again and go. And then I became a proficient swimmer, and I was on a swim team for 4 years. I mean, there was enough slack in the reins, if you will. And there was enough trusting that I would learn. I had an instructor, and then I would be okay. And then I became proficient and was on the lifeguard track. I decided not to. So it's just, there wasn't so much helicoptering around.
And that's exactly what girls need specifically too. And Leonard Sachs talks about that in Girls on the Edge, that girls need their parents to encourage them to take these safe risks. And you remind me of a story that something really sweet happened about a week ago, and I just haven't had or a couple weeks ago now, and I haven't had a chance to share it with anyone yet, but I want to share it now. So I was at the gym at the pool, and which is the best place for me to exercise with my chronic health conditions. The water really helps. And there was this couple, sort of a middle-aged couple. She was Latina and spoke some Spanish, and he was just sort of an average-looking white guy, and they were hanging out by the pool in the sun. And then he kind of got her to get up and move toward the pool, and she was expressing a lot of fear. So I'm like swimming, and I'm seeing them going from lounging happily by the pool, just chatting, to him nudging her toward the pool and her just acting really fearful. And she like had this whole awkward thing about getting in the water. She was like afraid to get in, and she had to get in this particular way, and she finally got in, right? And so I'm kind of, as I'm swimming my laps, I'm seeing their interactions, and he's trying to teach her how to swim. And I'm thinking, okay, this is pretty sweet. Like, middle-aged couple, she never learned how to swim, but she was being really fearful. And so at one point I came over with one of my extra kickboards, and I was like, maybe you want to try this because it gives you kind of a flotation up here, and then you can just focus on your back legs. And so they found that helpful, and then I kept swimming. And then at some point I was just like, I felt like they were open to me, and I really wanted to offer something. And I was thinking about how my fiance also never had swimming lessons growing up. And so we've had some moments in the pool where it occurred to me from watching him that before learning any techniques, what he needed to practice, and he kind of figured this out on his own, was simply putting his head underwater and exhaling, practicing that, right? Because when you think about all the movements involved in swimming, it's many things, but it's the breathing and the movement together. So just starting with the breathing.
That is right.
So I came over to her, and I was like, my fiance also never learned to swim growing up. And I think maybe there's a fear. Maybe part of what's causing your fear is unconsciously you fear that you're going to drown. So here, let's just practice breathing underwater. And I did it with her, and I mirrored her.
Wow.
And so I just sort of gestured. I was like, inhale. And she looked at me, and she had her goggles on. We both had our goggles on. And then I say, okay. And we both went underwater, and we were looking at each other the whole time, just exhaling. Awesome. And we practiced that a few times. And that was what she needed. She just needed to know that she could put her head underwater and control her breathing and just exhale, and know when it was time to come back up and inhale. That was what she needed to learn how to trust her body to do.
Trust her body. Absolutely.
And she needed someone to do that with her. And it was just after that, after we just took a couple breaths together, because her husband was, or boyfriend or whatever, he was way ahead of her. He was trying to show her all these strokes, but she was just needing to get comfortable.
Yes.
And it was funny, after that, as I kept swimming, she just looked so much more relaxed. She was just hanging out in the water, just chatting, laughing. And she was so cute. She called me hermana. She called me sister in Spanish. And then later she called me mama. And she just kept thanking me, like, in a mixture of Spanish and English. It was so cute. And I think there's so many people who just need the equivalent of that in their life. They just need to put their head underwater.
Yes.
That embodied experience.
Such a great analogy.
That real life, gradual exposure experience to calibrate the risk, because imagined suffering is sometimes worse than actual suffering.
Yes.
Once you start engaging the risk in small steps incrementally, you start modifying your perception of that risk too, and eventually you're proficient, like what you said. And I think it is the same. It is pretty much the same with the gender dysphoria, and that is why before the ideologues came to sabotage and to force everybody into just one direction, a direction that is not tested, a direction that's purely ideological. It's not, this affirmative model. It wasn't something that just that they experimented on or that came from actual material, and then based on evidence, now we apply the affirmative model. It was purely ideological, whereas the exploratory model is the one that is based in reality and in decades of research. And that is why with the exploratory model, upwards of 80% of kids find their way to have a congruent gender identity, if you want to say that, have integrated the reality into their imaginary, as opposed to imposing their imaginary onto the reality.
And exploration, it's not magic, it's not witchcraft. There's nothing really special to it. It's normal therapy, right? What we call gender exploratory therapy is really just treating this issue the same way we would treat any other
anything else. Exactly. All the other issues, there's nothing different.
It's what's really exceptional is this whole new standard of care that came from activists taking over our institutions that says that with this one condition, you must jump to the most invasive lifelong medical treatments and to getting everyone else in the world to recondition themselves to see and treat the person this way. That's not how we treat anything else.
If there's one thing that you would, or message you'd like to send to parents who are terrified.
That's what everyone asks me at the end of every interview.
So you probably, I am sure.
I was like, oh, it's coming.
Oh yes, because I'm not a parent, but I can imagine. I mean, I can only imagine, I guess, what it would be like to have this, just be terrified that my child's therapist or teacher or whomever is telling me, and my child, that they're going to kill themselves if I don't affirm something that I don't believe in. And so I mean that the terror of that as a parent, I can imagine must just be so overwhelming. So I guess, that would be kind of a question I would want to ask to you.
Yeah.
What would you say to them? How would you
I'll start off with my disappointing caveat that I say every time I answer this question, which is that this is part of what I make a living doing. Like half my clients, and I have consulting, and of course, every conversation. I mean, we do weeks of hour-long sessions to understand the particulars of a family situation. So of course, it's going to depend on a lot else in the family situation, the age and sex of your child, how close you were before this, what other issues they have, what all fed into this. Of course, there's a lot of other factors to consider, but my general advice is buckle your seatbelts because you're in for a wild ride. It's a marathon, not a sprint. I'm just going to mix all my metaphors here, right? But when your child tells you that they identify as trans, it is a big deal. Do not downplay the fact that this is something that could become very serious. But at the same time, don't panic, because you need to be able to keep yourself together. You need to be able to take care of yourself and sleep and function at your job. And honestly, if your marriage is in trouble, this is a really important time to get on the same page as your spouse. So you need to make sure you're taking care of yourself, because this can be very anxiety provoking. People lose sleep over this. They lose jobs, they lose marriages. You need to take care of yourself first and foremost. Take it seriously, but also think strategically. A lot of people I've noticed in general in life are not very good at thinking strategically, either in general, which is a problem, or maybe not when it comes to their own lives, but maybe they're like, I'm better at thinking strategically when it comes to other people's lives than it is when it comes to my own life. So that's what help is for. But I would say to really ground yourself, buy yourself time when possible. So when in doubt, say, I need time to think about this, and then go and do your research and talk to your helpers. Know your rights in your state. So this is one of those things that varies state by state. And it's important to know, for instance, in your state, can a kid get medical procedures at all? Can they get them without your knowledge? And what are the regulations in your school district?
Yes.
So there are some school districts that have a policy of transing kids behind their parents' backs. There are other school districts that have policies that what the parent says goes. And if the kid wants to use another name, the parent has to sign off on a form. And if the parent doesn't sign off on that form, then the kid has to go by their given name. So those are the kinds of things that you're going to want to know what your rights are. And whenever you are advocating for your rights with the school, let's say, knowing what ground you have to stand on, and being a little strategic means putting the other on the defensive. Are you aware that you are administering a psychosocial intervention on my child that can lead to medical consequences? What license do you have? What training do you have to be doing this to my child? Are you aware that reinforcing my child's so-called gender identity is likely to increase the persistence of the medical condition called gender dysphoria and increase the likelihood that, so there's times to put the other party on the defensive. There's times to know your allies. I know earlier, before we started recording, you mentioned Maria Keffler's book, so that's a great resource, Desist, Detrans, Detox, Getting Your Child Out of the Gender Cult. Other books on this topic are on my website. So if you go to sometherapist.com/bookshop, I have Amazon affiliate links to every book I can think of to recommend. And if you buy one of those books, I'll get like 30 cents. So, every
And where
dime.
can people find your podcast, Stephanie?
Oh yeah. So that's also at sometherapist.com. It's You Must Be Some Kind of Therapist can be found wherever podcasts can be found. So Apple, Spotify, Google, YouTube.
And tell us again the name of the film.
Okay, so you might have previously heard of our film under its early access title, Affirmation Generation. Now that we've partnered with a global distribution firm, our title is going to be No Way Back, The Reality of Gender-Affirming Care. And I even have a new website URL, which is nowaybackfilm.com. So that's nowaybackfilm.com. However, we are keeping our social media handles that we've built up followings under that are associated with the old name. So on Instagram, our handle is still Affirmation Generation. On Twitter, our handle is still 2022 Affirmation. And then I am at Some Therapist on both of those platforms.
I was very young when someone once told me, when you're at a party, go home while you still want to stay.
Yeah. Yes.
So make your podcast while you still want to chat. And I think that is an appropriate point to start.
Oh, I need that advice for myself. I let it go 2 hours sometimes. Thank you for that.
You know what? We would gladly have you on our podcast again. We appreciate your insight. You're well read. You have a lot of experience in this. We appreciate your courage, the energy you put forth, and in furthering this cause. That is what is necessary. The world has gone mad, and the most vulnerable among us are the ones suffering unnecessarily. And we want to thank you for your work, and we want to thank you for this lovely conversation that we had.
Oh, thank you, Jaco. That's very kind.
I do too. We didn't get to this, and I wanted to, and we didn't. There was just not enough time. But also, all of the work that you do with the school boards and with legislation and speaking at these different meetings, it's really incredible to watch that. I've been on some of your live streams before, and you've talked about that, and I've seen some clips of you there really trying to advocate for children. And it's not easy to do, and you're not always in an audience that's very welcoming to you. And so I just want to commend you for that. And hope maybe the next time around we can get a little bit more into some of that work that you're doing. But it's
Thanks, Christine.
It's inspiring.